Good morning, everyone. This is Dr. Armstrong with today's Therapeutic Talks. I want to wish everyone a happy month of March. I was absent a lot during the month of February, due in fact to my wife having knee surgery and helping her recuperate and basically taking care of everything that needed to be taken care of around the house while she is recuperating. However, I'm going to make up for lost time. I will do a video every week for the month of March. And March is the mental health, not mental health, but health and wellness month. So take some time out, see your doctor, make sure that you are up and healthy. And a lot of our health habits or either health disparities come from the way we eat. So we need to change our diet. Changing your diet can have a major impact on your physical condition as well as your mental condition. Today, we're going to look at something that I think needs a little attention that we don't often get a lot of attention on in the mental health world, and that is regulating our emotions. We are in a society now where everything is a pop, pop, go. And we don't really have time to be aware of what we're feeling, feel what we're feeling, have that sense of self awareness. Oftentimes, we often have so many blind spots to our own emotional state that we're really just operating off of pure adrenaline instead of rational thinking. So, today I want to talk about that the emotional dysregulation that many of us go through. And it's so easy to happen. And mind you, it's a term used, and we'll get into that. So many of us have it because we're in a world that is very fast moving now. But what I have to tell people is this: just because the world is fast moving and things are so topsy turvy doesn't mean that you have to be like the rest of the world. Okay. um, Gaining control, regulating yourself takes a lot of mental fortitude and discipline. When we begin to regulate our emotions, we can overcome a lot of the depressive symptoms or the anxious symptoms that we are feeling just by being in control. So, if you will, let me read off to you what emotional dysregulation is. It is a term used to describe an emotional response that is poorly regulated and does not fall within the traditionally accepted range of emotional reactions. It may also be referred to as marked fluctuation in mood swings, or a labile mood. Uh, when you are experiencing an emotional dysregulation, people who have this dysregulation, they have many angry outbursts, or an IAE intermittent. I'm sorry, IEA, intermittent explosive anger, um, angry outburst, anxiety, depression, substance abuses, suicidal thoughts, self harm, and other self damaging behaviors over time. And this is a lot of things, a lot of things that we need to really look at. We often don't realize that we are actually molding our brains and our mental capacities to conform to these negative traits instead of trying to fight them with more positive traits and to counteract what we are feeling. Okay. Signs of emotional dysregulation. Um, and let me go back. Really, this emotional dysregulation, I call it an instability as well. It can be a major disruption in your life if you are not in control of it. Okay? If you are not in control of it. So, what we have to look at is this: where is this dysregulation coming from? We have to get to the root cause of a matter, right? Get to a root cause of a matter. Okay. So let's take a look. What are the symptoms? Okay, let's get to the symptoms first. A lot of times, if we see the symptoms, then we can kind of pinpoint where the root cause is coming from, right? It's just like if you have cold, virus, you have the stuffiness, the watery eyes, the headaches, the coughing, the sneezing, the aches. Well, it's coming from what? A virus. We're treating symptoms with medication. In mental health, it's a little different. We have to treat the cause so that we can treat the symptoms. All right? Let's take a look. Severe depression, anxiety, high levels of shame and anger, self-harm, excessive substance use, high-risk sexual behaviors, extreme perfectionism, conflict in interpersonal relationships, eating disorders, and a major one, suicidal thoughts or attempts, any type of suicidal ideations, all right, or either attempts. Okay. Causes of the emotional dysregulation. There are a few different reasons why someone uh, may develop any type of dysregulation in their emotions. Early childhood trauma. And this is a big one that we've talked about for years, that we really need to get a handle on these childhood traumas. We need to let that inner child speak out. Let that inner child have a voice. If you experienced any kind of trauma in your childhood, get some help for it. Get some help for it. Okay? Childhood neglect. If you were neglected as a child, and there's a difference between a childhood trauma and a childhood neglection. A trauma was something forcefully happened to you. Neglect is when there's an absence of care. Okay? So if you were neglected as a child, this can be a cause of any type of dysregulation that you may be experiencing as well. Chronic and low levels of invalidation. Chronic low levels of invalidation. Uh, Mind you now, this occurs when a person's thoughts and feelings, when they are rejected, ignored, or judged. Rejected, ignored, or judged. So when there's so much invalidation, a person normally gets angry or they lash out, and they have all these explosive emotions behind the invalidation. All right. Let's look at some of the disorders. Okay, some of the disorders that are related, to emotional dysregulation. PTSD, a post-traumatic stress syndrome. Okay, borderline personality disorder. This is a mental health disorder that affects the way you think, the way you feel about yourself and others, causing problems with functioning in everyday life. Okay, it's a lot. Frontal lobe disorders is a lot there too. Any type of brain injury can actually cause this type of thing. All right. One of the best treatments to get is psychotherapy or counseling, as some may put it, or just therapy. All right. Uh, Cognitive behavioral therapy, dialectical behavioral therapy, emotional and acceptance therapy. All of these types of therapies are very good to help regulate the emotion. All right. There are, of course, antidepressant medications. I'm not really big on the medication part. I am a fan of ashwagandha root. If you're able to take it, take it. ashwagandha root. Take it. Okay? It is a very, very potent herb that will help level out the cortisol levels in your system. Okay? And then there's emotional regulation. Teaching yourself, teaching your autonomic system how to regulate emotions, and teaching your body how not to get overexcited over little things that may throw you off. Okay? Now, with all that being said, uh, there are new psychological tools that we use in mental health that can help you overcome some of these dysregulations. I think meditation is a good one. And I'm going to take it a step further. Praying is a good one. Meditation and prayer can go hand in hand. Oftentimes, we are so busy in our daily lives that we just don't stop and take the time to look inward. I want you, if you are experiencing any of these, take the time to become self-aware. Take the time to feel your own emotion. Take the time to just understand yourself. Okay? Seek out therapy. Everyone knows I'm a therapist. You're more than welcome to contact me. We can get together and help you in these situations. Okay? Mainly is this: take the time to take time for yourself. All right? Folks, I hope that you have enjoyed today's episode. Please like, subscribe, share in the video community as well as the podcast community. Let's take better care of ourselves, all right? And until the next time, which will be next week sometime next week, have a good one.